Good evening, everyone, and thanks to all the Democratic committees and Democratic coalitions for sponsoring tonight's event around Medicare for All. And great to be here with Lynn. Lynn and I have done a couple presentations at the State House and other parts of the state. Great to be here with Heather and Bill. And as Lynn noted, I do serve as the Senate sponsor of an act to establish Medicare for All in Massachusetts. It really began, just like in many other states, in sort of the late 90s with a push to say, okay, we're facing some barriers in passing Medicare for All at the national level, so let's see what we can do at the state level. So I was not the sponsor of the bill in the 90s, but once I got elected to the Senate, I became the Senate sponsor, taking up the helm from Senator Pat Jalen from Somerville. And I'll there's so many different things to say about our healthcare system. Is, the first thing I'll say is today I didn't come from Acton, I came from the State House, and this morning there was a Mass Medical Society briefing on basically the legislative agenda for the doctors who are part of the Mass Medical Society. And to be clear, the Mass Medical Society does not support single payer, but in the presentations on the bills that the Mass Medical Society is highlighting and is endorsed, it's about reforming pre-authorization for medical care, especially for specialists. It's the primary care crisis where many medical students are not becoming primary care physicians, or those that are in primary care are leaving the practice early. Complaints about paperwork. Doctors who testified this morning that they're now spending about 60% of their time just processing paperwork. Now, I have no doubt that the Mass Medical Society, has specific bills to address all those things, but the reality is, and I think we're really seeing this on Beacon Hill, where every session we pass certainly important healthcare legislation, including this past session around venture capital firms not owning or not having investments in hospitals because of the Steward healthcare crisis, whether the mental health and substance abuse bill we passed, whether the maternal health legislation we passed because of the outrageous disparities around race and ethnicity for women. And those were very good pieces of legislation, but I think there's a recognition increasingly, I would say more often than not by the people than perhaps elected officials, that the problem is the system itself. That if you have a system based on profit, whether it's health insurance companies, whether it's hospital CEOs, whether it's some medical professionals, if all of them are making decisions based on profit, we know we're not going to provide great quality healthcare for everyone as a right. And I think there's a greater recognition of that. I think the challenge is how to get there. And what I would submit, even before Donald Trump became president again, is that as much as I'd like to think that the path to Medicare for All is at the national level, we saw what happened when President Clinton tried to pass some form of national health care. We saw what happened by President Obama, who did an incredible job, but unfortunately wasn't even able to push for the public option. There's major forces, of course, against Medicare for All. I think the path, and this is of course how Canada reached its goal, is at the state level. Canada did it based in one province and expanded it nationally. So I think the path there is at the state level, and what better state than Massachusetts? We do have the best health care in the world. The problem is very few people can access that. And there's a lot of other problems with our healthcare system as well. I mentioned the Steward healthcare collapse. My district includes a region called the Neshoba Valley, which is one of the hospitals that closed because of the Stewards falling into bankruptcy. Now those are 15 rural, mostly working class communities that don't have access to a community hospital. In Worcester County, there was a health insurance company, .123 Health Insurance. They came within weeks of dropping health insurance for tens of thousands of Worcester County residents. We have different public health crises, whether it's the opioid health crisis, whether it's mental health challenges, especially for young people, whether it's nutrition issues among some people throughout the state that really aren't being addressed by our healthcare system. We can't focus, government can't focus and say, how do we solve this particular crisis in this particular region of the state? And then at the municipal level, sort of municipal government level, I know in my district, and I represent 12 communities in Metro West, many of those communities are passing overrides only to see 50, 60, 70% of that override go to pay for this 15, 16, 17% health insurance premium increase to provide for school employees and municipal employees. So it's causing a lot of financial problems at the municipal level as well. So those are all the different problems. And I do think it's time for a systematic overhaul of the healthcare system, and I'd be the first to note that it is certainly challenging. But what we are doing, and why I hope I'm here today, and I so appreciate Lynn's work and so many single-payer activists here, including my fellow panelists, is how do we build the single-payer movement? Because leading up to the 2018 criminal justice reform, sort of a once-in-a-generation reform around criminal justice, something I'm also very involved with, that came to coming to gatherings like this, whether independent voters, Democrats, progressives, people who are deeply concerned about the direction of our state or a certain issue, and organize around the state. So I've been in Ayer, I've been in Fitchburg, I've been in Maynard, I've been in Acton, talking about Medicare for All and how do we get there. I won't go into too much detail about what Medicare for All is, but I just want to give a couple of highlights and really look forward to the discussion. Is, Medicare for All, first of all, is at least in the ideal form, is there would not be health insurance companies. And so there would be a couple of taxes. There would be a payroll tax and a tax on capital gains, so basically a tax on generally those who are wealthier. And it would fund the system matching with the federal dollars that we currently get, hopefully we'll still get those federal dollars, to pay for a single payer system where that money comes in to a healthcare trust, and that healthcare trust directly pays hospitals, doctors, nurses, other medical professionals or medical practices, and eliminates health insurance companies. Now that already eliminates billions of dollars of waste that we are all paying, whether through premiums, co-pays, or through the different taxes we pay. That saves that money, straight up across the board. But what it allows is doctors, nurses, other medical professionals to focus on providing medical care for their patients and not having to worry about paperwork, not having to get prior authorizations, not having to figure, well, actually, if I recommend this test, this is how I'm going to sort of earn my income throughout the year, is recommending certain tests or maybe just out of caution recommending tests because of the often confrontational interaction between doctors and patients. So it's creating this healthcare trust where there would be tax dollars that come in, and then the healthcare trust would create a vision for what the healthcare system should be. What should be the payment for primary care physicians? What should be the payment rates for specialists? Where do we need community hospitals? Where is there a particular public health crisis? Where is there a need for certain, high-level medical attention? And where is there an area where it's already highly concentrated and we don't need that additional expenditures spent on certain equipment or medical practices? So that's certainly a complicated process, but the process we have now where people are waiting 6 or 7 months to get certain surgeries, I know certainly talking, heartbreaking stories, talking to parents who are constituents about their kids not being able to access a psychiatrist or psychologist that have severe depression, to again, suddenly community hospitals disappearing like what we saw this past year with the Kearney Hospital in Dorchester and the Neshoba Valley Medical Center in Ayer. So we really can do a lot better, and I think the idea is, and would welcome you to join this effort, which is sort of led by Mass Care and leaders like Lynn, is join this effort, because I think as much as I know right now is a very scary time, there are things we can do at the state level, there are things we can do to be proactive to to create a better system. And sadly right now, if we have a federal government that is literally attacking American people, literally attacking its residents, that's a time to show state leadership like Medicare for All. So proud to refile the bill alongside Representative Lindsay Sabadosa and Representative Margaret Scarsdale. So we sort of have regional representation for this bill. And it's really having these kind of discussions, not only with residents and municipal officials, but also business owners, school districts, talking to patients about their healthcare horror stories, coming up with all these ideas and advocating. And as I'm sure it could be mentioned, there is a Mass Care Lobby Day on April 1st, so that's coming up. So I hope to see many of you there, but I look forward to the discussion and recognize that many people have questions about how single payer works. But I do really feel a growing support for it, and I think Massachusetts should be the first to establish healthcare as a right. Thank you so much.